Welcome to The Explainer. Today, we're going to try and solve a frustratingly common medical mystery. You know that nagging pain, the one that lives in that kind of blurry zone right between your neck and your shoulder? Yeah, that one. It's a puzzle that sends millions of us looking for answers. So let's start with the big question, the one so many of us have asked. You feel an ache, maybe a stiffness, or even a sharp twinge, but where is that pain actually coming from? Well, the answer is way more complex and honestly pretty fascinating than you might think. And to get a sense of just how common this is, let's put it into perspective. Every single year, somewhere between 10 and 21% of adults deal with neck pain. I mean, think about the last 5 people you talked to today. Statistically, one of them is probably dealing with this right now. And look, this isn't just some minor annoyance. Neck pain actually ranks as the 4th leading cause of disability across the globe. It impacts our ability to work, to enjoy our lives, and just to get through the day without being uncomfortable. So yeah, let's get to the bottom of what's really going on. Here's the heart of the problem. The symptoms often overlap, and that creates a real challenge when it comes to figuring things out. You might be feeling the pain right in your shoulder, but the actual root cause could be hiding up in your neck. So why is it so confusing? It's all because of something called referred pain. Your body has this incredibly intricate network of nerves, and a problem in one spot can trigger pain signals that you feel somewhere else entirely. It's kind of like a faulty warning light on your car's dashboard. The light might be on, but the real problem is deep inside the engine. Okay, so how do we solve this mystery? Well, we have to become detectives. We've got to follow the clues, and those clues are left by the nerves that travel all the way from your neck down into your arm. One of the main culprits here is a condition called cervical radiculopathy. I know, it's a big medical term, but it's basically what most of us just call a pinched nerve in the neck. When one of those nerve roots gets squeezed or irritated, it doesn't just hurt right there. It sends out distress signals all the way down its pathway. And this is where the clues get really specific. See, each nerve root coming out of your neck has its own territory. A problem up at the C3 or C4 level, for example, can create this shawl pattern of pain right over your shoulder blades. A C5 issue often feels exactly like a shoulder problem. And if you've got issues with C6 and C7, that's when you feel pain traveling right down your arm to your hand. And it gets even more precise. This is how doctors can often pinpoint the exact nerve involved just by listening to your symptoms. For instance, if the pain shoots down to your thumb and you feel like your bicep is a little weak, that points right to the C6 nerve root. But if the pain goes to your middle finger and your triceps feel off, well, that's a classic sign of a C7 issue. Pretty cool, right?
But hang on, the story gets a little thicker. The nerve pathways are like the wires, but now we need to find the master switchboard, the place where all the signals can get crossed.
Let me introduce you to the cervico-trigeminal complex. Just think of it as like Grand Central Station for sensation. It's this neural hub deep in your brainstem where all the pain signals from your upper neck, your face, and your head all meet up and mingle.
And this connection is so powerful that it explains a really common mystery. Why do so many people who get migraines feel neck pain first? It's because irritation in the upper neck can actually be interpreted by the brain as a headache. For a whopping 70% of people with migraines, neck pain is the opening act.
Now just imagine what happens at Grand Central Station during rush hour. It gets totally overloaded. When this neural hub is constantly being bombarded with pain signals, it can become hypersensitive. This is a process called central sensitization, and it's basically like your nervous system decides to turn the volume way up on all pain signals, making everything feel much more intense.
Okay, so we've covered the wiring, but what about the physical structure itself? It turns out this isn't just about nerves, it's also about physics.
I want you to think of your neck, your shoulders, and your upper back as a series of connected dominoes. They form what's called a kinetic chain. And the thing about a kinetic chain is you can't move or change the position of one part without affecting everything else down the line.
So what usually knocks over that first domino? You guessed it, poor posture. When your head juts forward, that classic text neck posture, it dramatically increases the load on your neck muscles. This forces your shoulder muscles to work overtime to try and compensate, and that creates an imbalance that leads to more strain, nerve irritation, and then a vicious cycle of pain.
And here's the really crucial part. This is a two-way street. It absolutely works in the other direction too. If you have a primary shoulder problem, say a rotator cuff tear, you'll probably start holding your body differently to protect it. Well, that compensation can lead to secondary muscle strain and pain right back in your neck.
Okay, so with all this info about nerves and mechanics, how can you start to crack the case of your own pain? Let's look at some really practical clues.
All right, here's some simple things to ask yourself. If turning your head makes the pain worse, or if you feel any numbness or tingling down your arm, that's a clue pointing towards the neck. If reaching overhead is the main issue and the pain pretty much stays put, that's more likely a shoulder problem. And here's a really fascinating trick. Try resting your arm on top of your head. If that actually brings some relief, it's a very strong sign the problem is a nerve in your neck. Now, while figuring out these patterns is super empowering, we need to talk about some critical warning signs. These are the symptoms that mean you should stop trying to figure it out yourself and see a doctor right away.
These are the red flags. Things like weakness in your arms, it's getting worse quickly, trouble walking or with your balance, or any changes in bowel or bladder function. These can signal a serious problem with your spinal cord. Unexplained fever could mean an infection. These are not things you wait and see about. They require immediate medical attention. Seriously, please don't ever ignore these signs.
But it's really important to remember those scary red flags are rare. The good news is that for the vast majority of cases, getting a clear and accurate diagnosis is the key. That's what unlocks effective treatment, which often starts with simple, conservative care like physical therapy and working on your posture.
Ultimately, the goal here is to empower you. By understanding how your neck and shoulder are so deeply connected through both nerves and mechanics, you can have a much better conversation with your doctor or physical therapist. You can describe what's happening more clearly and really become an active partner in your own recovery.
Which leaves us with a final thought. Pain is a signal, right? It's your body's way of talking to you. Now that you know a little more about the complex language it's speaking, how will you listen differently to its messages? Thanks for joining us to decode the signals here on The Explainer.